So we're looking at the reconstruction of what? Acetabulum with prosthesis or graft. So it's just another way of repairing any issues at the hip joint. Okay, so I'm trying to reconstruct, okay, with prosthesis. So let's look at this. So reconstruction of the acetabulum with prosthesis or graft is a major orthopedic procedure and is performed when the hip socket, that's the acetabulum, is damaged, deficient, or deformed. Most commonly due to trauma, arthritis, and so. So what are the indications? If there's fractures, acetabular fractures, maybe they did a hip surgery but it failed, so they want to do revision again. The congenital deformities, then bone loss due to infections or tumor resections. So reconstruction option is can use prosthetic reconstruction. So total hip arthroplasty, acetabulum component is implanted into the socket. May use cemented or uncemented fixations. Then we have special prostheses where you're having all those trabecular metal cups. This one, okay, you can have cage construct, and also the custom acetabular implant. Okay, have graft reconstruction like the patient's own bone. So they can take it from the iliac crest, for smaller defects. Allograft where there's a bone donor, So it's often combined with prostheses for stabilization. So surgical principles is this: you access the defect size and location. Okay, you restore hip center of rotation for biomechanics. You achieve stable fixations. You combine graft and prosthesis if bone stock is insufficient. So this is what we have for this corrective procedure.